New York City is the one region that is not reopened yet in New York. And that's for obvious reasons. The numbers have been worse in New York City. This is a dense area, New York City, public transportation. So it had the worst problem in the nation, one of the worst problems on the globe. So it's the one region that's not reopened yet, and we're now going to focus on reopening New York City. And again, we do it smartly. We have data, we have tests. We can focus on the new cases in New York City. Where are those infections still coming from? And we literally can now focus on those areas by zip code. If you have that kind of intelligence, that kind of data, then you can target your resources right to those areas. Those zip codes tend to be predominantly minority communities. The infection rate is not spreading among essential workers. It's spreading among workers who have stayed home or who are unemployed. So it's spreading in the home, it's spreading in the community. We're going to focus on those zip codes. We're going to focus on those communities, and we want to slow the infection rate even in those communities. And that will really bring the numbers down in New York City. We've started that last week, but we're going to bring it to a new level starting this week. And you can see that the infection rate in some of these zip codes is double the infection rate in the city. The infection rate in the city, general population, is about 19%, almost 20%. In some of these communities, the infection rate is 40%, literally double the citywide average. And when we look at those new COVID cases coming into the hospitals, where are they coming from? They're coming from these zip codes. And we can literally identify it, so we want to attack the virus at the source. That's what we're going to be doing in New York City.